Welcome friends, I am Dr. Bharat, this is Mr. Sai Kishore. Today we will decode the primer of genetic counseling. I am a medical oncologist. I see a lot of cancer patients, young, old, etc, etc, etc. There are n number of questions, n number of efforts it takes for me to explain what is genetic counseling. And people ask, sir, I don't need genetic counseling. You explain whatever it is there. What an expert can do, I cannot do the justice to the topic. And hence, today we have the expert with us about the genetic counseling, why it is necessary, how it is done, what to be done, what to expect, etc, 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 A to Z. And we call it a primer series because the DNA, your genes start with a primer. Right, Mr. Kishore?
Yes.
Yes. So, primer to genetic counseling in cancer care, specific to cancer care. Dr. Bharat, Mr. Kishore, genetic counselor, chief medical oncologist, Pi Cancer Care. Mr. Kishore, first, how you started with your journey in genetic counseling?
So, first, thank you for having me here. And I have done my bachelor's in genetic engineering, and post that I have done my internship in genetic counseling in a medical genetics department.
Wonderful.
And after that, I got into Counselor Medical College for my master's in genetic counseling.
Oh, KMC.
Yes, KMC
Manipal. Wonderful. Absolutely wonderful.
There,
I am also from KMC Manipal.
Okay.
My BBS is from there. So, small world.
Yes. And after that, I have been practicing genetic counseling since 3 years now.
Oh, wonderful. Oh, wonderful. So, to be very simplistic about the topic, when a patient asks to me, sir, what is this genetic counseling? Do I need it? How it is done? How briefly, crisply, least amount of words, with maximum information I can tell to the patient, tell me what is genetic counseling, exactly what I should tell the patient so that they should remain motivated about this important part of cancer care.
So genetic counseling is just basically a communication process. It involves taking detailed family history of the individual or the family, whoever comes to us, and based on that, if there is any hereditary condition that is possible, then we'll see it and we'll interpret it and explain it to the family.
So, to be very frank, India got its independence couple of decades back only. Our ancestors were very good in keeping family tree, who is married to whom, what children, and etc, etc, etc. But in today's world, when I actually take the family history of did your mother had cancer or father had cancer, what about their grandfather, they really don't give me a very conclusive answers, clear answers. So how do you solve these problems of incomplete or poor information from the patient?
So in the first session at least, I will gather whatever information the family knows who are attending the session, and if there are any elders available with them, or they can take up the call and ask their immediate family members about their extended family, about presence of cancer or early death in family. I will give them time to gather the information and then complete the history.
Okay, so you actually push them to ask your relatives, maybe your aunt, what exactly happened. Probably based on the history you will interpret, oh okay, somebody's death happened because of fluid filling in the abdomen, so they might be having some kind of GI cancer or ovarian cancer. So these kind of what you will push them to get the details. Yes, because in clinical practice, when we try to push, they'll give me a very strange look. Why you are asking about so old history and mothers, aunt and all? I am the patient, I am sitting in front of me, treat me. But yes, the education about the natural history, how it is progressing in the family, it does make sense and you are the better expert of it. And how else do you think genetic counseling can support in terms of cancer care?
So in cancer care, the first thing I would like to say is genetic counseling and genetic testing are completely different. And genetic counseling is not just limited to testing, and counseling has two parts. One is pre-testing and another is post-testing. In both of them, when a patient is referred from a cancer clinic or by an oncologist, first after gathering the history and all, we'll identify the patterns. If there are any patterns present in the family or in the previous history, and then we will coordinate with the oncologist and offer them any test if and when required.
So, Mr. Kishore, just for a takeaway message for our listeners, and since this is a video, our visual audiences, how do you integrate this process of genetic counseling? What are the simple 2-3 steps?
So the first thing would be interpretation of family history and medical histories. This is to assess the chance of a disease occurrence or recurrence in the family or in the member. And the next step would be educating about the nature of history of the condition and the pattern that is observed in the family. And so this will provide us necessary resources and help us promote the patients to have informed choices about their medical and personal life. And next, here we will support and encourage the family in the best adjustment possible as per the disorder or disease that is seen in them.
Okay, so you take the information, you tell, you analyze first, and then give a digestible information to the patient, and which allows them to take decision about their cancer care, because all my patients are cancer patients. Mr. Sai, actually I heard during my training, again in Manipal, Mumbai, Pune, everywhere, genetic counseling, or even now when actually there are certain genetic labs, the tests, their doctors or their team members, they come so that this test is available to find out whichever cancer is running in family. They tell me, sir, there is a pre-test counseling and post-test counseling. So what is this pre-test counseling and post-test counseling?
So pre-test counseling and post-test counseling, as the name implies, pre-test is done before performing the test and post-test is done after the test results are done. And in pre-test, we will mainly focus on history gathering, family history gathering, and evaluate all the previous medical records of the patients and the other family members, whoever has any condition that is observed. And we'll explain the family or the patient that is there, what type of test might be required for them, and we'll offer it to them. And while doing that, we'll always explain all the possible outcomes from the test. Because unlike other tests, when it comes to genetics, there is no particular threshold which says if individual crosses, for example, 80 or 90, they are pre-diabetic. So in genetics, there are 3 types of reports when it goes to broader testing, that is pathogenic, non-negative, and variant of uncertain significance.
Okay. So as I understand, pre-test counseling is the part where you are just gathering the information. Based on the information, you do a certain type of genetic testing, which could be small panel or big panel, depending on the socio-economical as well as the family history of the patient. And based on that test report, you are doing what are the implication of the test, which is known as post-counseling. Am I correct?
Yes, but in pre-test counseling only, we will explain what are the possible outcomes. Because if a family comes and goes with a test that we have offered, they should be aware of all the possible outcomes, that even that there might be a negative report. Meaning after spending so and so amount of money, nothing actionable can be found from a genetic test.
Okay.
So the general rule is, the better the pre-test counseling, the easier the post-test counseling will be.
So, Mr. Sai, I always use this line, today's patient are partially informed. Whether it is ChatGPT, whether it is Google, partially informed. They have not studied like you and me, but they get some information from any of the platform. So they come and ask, sir, is the cancer genetic? Is my cancer genetic? In my family there is no cancer. How come I got the cancer? So I always say one statement: all cancers are genetic because there is some gene which is disturbed, but not all cancers are familial or inherited. My first thing is, do you agree or not?
Exactly. All cancers are genetic, but not all are inherited.
Yes. Now comes my second problem, clinical problem. When I say this line, two things happen. First is a bouncer's face. So a patient, usually, patient says, what did he say? Cancer is genetic, and he's saying it is not familial. So my patients are not able to understand the difference between genetic diseases and inherited diseases. Can you help me with that?
Yes. So any condition that is caused due to changes in our DNA is a genetic disease. So basically, for example, when we write something while seeing from a book, there are chances of that we'll make errors in it. For example, let's take my name itself. My name is Kishore, and many of the people will write Kishore with an E, like myself, and many of them do not write E in the spelling of Kishore. So that doesn't change how we pronounce Kishore, it's just a change in the spelling. So similarly, if there is change in DNA, there are changes that do not impact how the DNA is read by the cell and how it functions. And for example, taking my name as again, if someone does not write I and just skips I, then it becomes something not sounding similar to Kishore. So when a change happens in a region where DNA is not able to read properly, then it becomes a harmful change.
So how I explain to my patients are this statement that all cancers are genetic but not familial. I'll use analogy like a person can inherit money from grandfather. Same way, from grandfather he has inherited his face also, body, height, color, hair, etc. and money also. Same way, genetic genes is coming in the family like money from grandfather to you. It is familial. It is coming along with you. Now your genes, your body is dependent on your grandfather, father and it, but you are not same. So you somehow develop some differences also. So if your body developed some changes, that is you, not because of the grandfather. Money from father is familial and changes in you is yours. So that is genetic. So now after they understand this, then I introduce them to the concept of somatic. Somatic is yours and germline is there. And I face so much trouble because germs, people think of something like infection and they start confusing that cancer is infectious and my son or daughter is under risk because it's an infection, it will transfer to them. So much of confusion. How do you think you can explain the difference of somatic and germline to a normal, non-medical read person? Well educated, but not medically read person.
So rather than using the word somatic and germline, we can use the words sporadic and inherited. Sporadic sounds like spontaneous. Sporadic meaning spontaneous, that is happening within the cell, like you are saying, how we are different from our grandparents, that is sporadic, and the money that is inherited are the genes that are inherited from the grandparents.
Okay. So sporadic is what happens with the person for whatever reason. Familial is something which is running, and hereditary. So difference between hereditary and familial?
So hereditary is clear cut, that is passed on from generation to generation.
Okay.
When it comes to familial, it is in between of gray area of sporadic and inherited. The thing is, familial have multiple factors to it, like a family in the close quarters can develop similar type of cancer. It might be due to unknown genes involvement that are caused due to sporadic variations as we develop. and due to environmental factors and similar habits of lifestyle.
Okay, so if I absorbed it correctly, to explain, because of certain plus minus environmental factors, which may involve diet, pollution, etc., 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 there are some changes happening, which can happen in the family as a group, and if grandfather and then father and son and next generation is developing, that is known as hereditary. How do you think these changes which is happening in the cancer, either sporadic, familial or hereditary, actually causes the cancer? Which type of genes are there which actually causes the cancer to develop? Can you throw some light for our audiences?
Yeah, so there are two classes of genes that are involved in cancer. One is oncogenes and tumor suppressor genes. So when one is oncogenes and another is tumor suppressor genes, and if only one variation is caused in any of these genes, sporadic cancers do not occur. A minimum of 6 to 8 variations should happen in a single gene. Only then cancer will occur in individuals. That is what is seen in sporadic cancers. So coming to the oncogenes and tumor suppressor genes, the classes that you are saying, oncogenes are like accelerators. They tell our cells when to divide, how much to divide, how to divide. So they help us in healing and growth. And and the next is tumor suppressor gene. They are like our brakes. They tell if there is any change, that any sporadic change that has happened previously. They'll give time for the cell to correct itself, and then they'll give time for the cell to correct itself, and if the cell is unable to correct itself, they'll tell the cell to do not grow more and just lead to cell death called apoptosis.
So, correct me if I am wrong, what you want to explain is that everybody, you, me, patient who has a cancer, everybody has oncogenes, everybody has tumor suppressor gene. Oncogene function is grow, and tumor suppressor gene is stop at certain level. So the normal function of these genes are this. Because of familial reason, because of sporadic reason, whatever reason in the past, there is an imbalance in these two, which is causing increase in the growth and the control mechanism not working.
Yes.
So this is what has happened.
Yeah.
Right, that which causes the cancer. Yeah.
So if we take an example here, this image shows cell proliferation means growth of cell, and cell death means stopping of cell growth or death of cell. So the green ones are the ones who tell it to tell the cell to grow, and here if you see positive regulator means, here if you see positive regulator means they tell cells, oncogenes tells the cell to grow, anti-apoptotic genes tell the cell to not grow further. Similarly, negative regulators, tumor suppressor genes tell not to grow further, and apoptotic genes tell the cell to go into the death phase.
So how I explain to my patients is, so we are medically educated, we know about this term, but people don't understand apoptotic. So I tell them anytime you see pop, it means it is towards the death, apoptotic. So you can see this, there is a pop in apoptotic, and anti is which is stopping. So all these classical oncogenes, telomerase, these causes the towards the death, right?
They regulate it. Yes, oncogenes help in growth of the cells. Here, telomerase and classical oncogenes help in growth.
Okay, now I got it. So you are saying these two are working for the cell proliferation.
Yes.
Increase. These things are preventing the cell growth. So they are kind of danger towards these classical tumor suppressor gene, and indirectly controlling gene is reducing the cell growth. and these apoptotic genes will cause actual cell death. Any abnormality in this will result in more growth. Right?
Yes.
Death will not happen. So, yes, understood.